Welcome to this third video on arterial blood gas interpretation. Let's quickly go over what we've covered in the last couple of videos. In the first video we talked about the sort of process of interpreting arterial blood gases, and that we have a sort of strict classification or interpretation, and that needs to be paired with clinical context. But the strict classification, or this sort of strict interpretation, is going to involve looking at the acid-base status, any primary disturbance that exists, and whether or not there's compensation for that primary disturbance. So in the first video we looked at the acid-base status, and we said that the index that we use from a blood gas is the pH. That's the best indication of the acid-base status of the blood, is the arterial pH. We looked at acidosis, a situation where the pH is less than 7.35. We looked at alkalosis, a situation where the pH is greater than 7.45. And we talked about the effects that those two have on the central nervous system. Then in the next video we looked at what can be the primary causes of these acid-base disturbances, and we found that there are two main categories of causes, those being respiratory and metabolic or non-respiratory. And the indices for those are the PaCO2 is the respiratory index we use for sort of evaluating the respiratory component of the acid base, and the bicarbonate is the one that the most widespreadly used index for the metabolic component. So we typically use CO2 and bicarbonate, and we looked at the values for that and what causes what. So in this third video, we're just, before we start getting into some examples, which is where I really think you're gonna start to learn how to do these interpretations, we're going to just look at compensation and what that means and what it sort of means for blood gases. So let's just move over here and zoom in a little bit, and we'll talk a little bit about compensation. Ooh, there we go. Okay, so compensation is really the process by which the part of the blood gas which wasn't primarily affected. What I mean by that is, let's say we have a respiratory acidosis, which is a state of acidosis in the blood, so the pH is going to be less than 7.35, and we've identified that the primary disturbance is a respiratory cause. So our CO2 would be elevated above normal, causing CO2 to dissolve in the blood as carbonic acid, making the blood more acidic. So we found out that we have a respiratory cause for an acidosis. Okay, and then what I mean by the non-effective component is that is there any effort by the metabolic side to try and pull that pH back towards normal? Is there any effort from the bicarbonate concentration to perhaps pull the pH back towards normal? So what we mean by compensation, let's put a little squiggle around this. Compensation is really the movement of a pH towards normal by the acid-base component, not primarily affected. Okay, so this is really just a homeostasis thing, which is common in a lot of bodily processes, is that the body wants to maintain homeostasis, and an acid base is no different. So if we have a disturbance in that acid base, the body's going to make an effort to try and bring that back to normal, and that's that sort of process of maintaining homeostasis. So when we have a compensated blood gas, what it means is that we have a primary disturbance, but there's been effort from the other component, whether that's the metabolic component or the respiratory component, to try and bring that pH back to normal. So let's do just a quick example, and then we'll go into like actual examples, because I think that's the best way to talk about this. So let's say we have an increase in our PaCO2. Okay, so that's going to cause, and it's causing acidosis. Okay, so we have what we'll call, and you'll learn these in the next video, this is a respiratory acidosis. Okay, so the pH is less than 7.35, and the cause of that pH being less than 7.35 is the fact that our PCO2 is elevated. Okay, so we have an acidosis, and it's of respiratory origin. Okay, So as a result, what the kidneys are going to do is they're going to start to retain bicarbonate. There's a sort of in and out import-export of bicarbonate at the kidneys. Well, really, it's more of an excretion and retention. But as we saw up in the bicarbonate section, we saw that increasing bicarbonate concentration makes the blood less acidic. It makes it more alkaline. Okay, so what the kidneys are going to do in this situation is they're going to start to retain bicarbonate. Okay, so there's going to be bicarbonate retention, which is going to lead to obviously an increase in bicarbonate concentration, right? If we retain it, and that's going to make the pH go up. That makes the pH more alkaline. So what happens is we have the PCO2 pulling the pH down, but in response to that, the bicarbonate ions get retained by the kidneys, pulling the pH back up, back to normal. So if we try and just show this here, if we talk about sort of effect on pH, which we'll do a lot in the next videos, effect on pH, we had the PCO2 going up, which causes a decrease in pH, right? And then in response to that, we have bicarbonate concentration going up, which causes an increase in pH. So and the goal is that these will start to offset each other and bring the pH back to normal. That is the idea of compensation. And as we get to the examples, you'll see that we can either have full compensation, which is when the pH is completely returned to normal. We can have partial compensation, which means that there's movement from the non-primarily affected acid-base component, but it hasn't restored the pH completely to normal. And we can have uncompensated acid-base disturbances, where there's a primary disturbance which is met with zero compensation from the other component. So I hope I haven't confused you on that. This is basically just an attempt to maintain homeostasis. And you'll see in the next videos how these work. So it's a movement towards normal of the pH caused by the not primarily affected acid-base component. So if we have a primary cause was a CO2 increase, then maybe the bicarb will start to increase to try and pull that pH back to normal. If, for example, it's the other way around and we have the bicarbonate ion increasing and making the blood more alkaline or more alkalosis, then the CO2 may start to increase to counter that, making the blood a little more acidic. So just to try and pull that pH back to normal. So in the next videos, we're going to get right into examples and we're going to look at all of the different types of acid-base disturbance, and we're going to start doing some interpretations.